I want you to think about something that happened recently, maybe this morning. You woke up and your eyes felt dry and scratchy before you even got out of bed. You squinted at your phone to read the time. Later at the restaurant, the menu across the table went blurry, and you held it closer, then further, then gave up and ordered what you usually order because reading it clearly was too much effort. And driving home that evening, the headlights from oncoming cars spread out into those uncomfortable starbursts that make you grip the steering wheel tighter than you used to. You have probably been telling yourself this is just aging, that this is what happens to eyes after 60 and you simply have to accept it. I want to offer you a different possibility today. Not a miracle claim, not a shortcut. A biologically grounded explanation for why the specific things that are happening to your vision are happening, and what certain everyday fruits eaten in a specific way at a specific time of night can do to support the repair processes your eyes desperately need while you sleep. My name is Dr. WillIiam Madison. I have spent years working with older adults on the question of how nutrition affects eye health, and what I am about to share is based on a growing body of research that most people, including many eye care professionals, have never had the time to fully explore with their patients. Before we go any further, I want to be clear about something important. Everything I am sharing today is educational. It is not a replacement for professional eye care. If you are experiencing vision changes, sudden blurry vision, new floaters, or any eye symptoms that concern you, please see a licensed eye care professional before making any changes to your diet or supplement routine. Your eyes are not something to experiment with unsupervised. With that said, let me explain what is actually happening inside your eyes at night, because this is the foundation of why timing matters so much for everything I am about to share. Most people think of sleep as a passive state. Your body rests, your eyes rest, nothing much happens. But for your retina, the thin sheet of light-sensitive tissue lining the back of your eye, nighttime is actually the primary window for cellular repair and maintenance. The photoreceptor cells in your retina, the cells that allow you to see color, detail, and contrast, undergo their most significant repair processes during deep sleep. They clear oxidative damage that accumulated during the day from light exposure. They restore chemical compounds that were depleted during waking hours. They receive oxygen and nutrients through tiny blood vessels called capillaries that supply the retina. When this overnight repair process runs efficiently, your vision remains stable and clear. When it is disrupted by oxidative stress, chronic low-level inflammation, poor circulation to the retina, or a process called glycation that we will discuss in detail, the photoreceptor cells degrade slowly and silently. Most people do not notice the cumulative damage until it has been building for years. Research published in a major ophthalmology journal confirmed that age-related retinal damage often begins with silent changes deep inside the eye. These changes are most active at night, precisely when your eyes should be doing their deepest repair work. They are driven by oxidative stress and chronic low-grade inflammation, two processes that specific compounds in certain fruits are able to directly address. The National Eye Institute has noted that vision loss among older Americans is rising at rates not seen before in recorded history. Conditions like age-related macular degeneration, cataracts, dry eye disease, and glaucoma-related vision loss become significantly more common after 60. What the standard eye care conversation rarely includes is the role that nutrition plays in whether these conditions progress slowly or quickly. Today, I am going to walk you through 7 fruits that research suggests can actively support your eyes' overnight repair processes and give you the specific preparation and timing details that determine whether you actually absorb the beneficial compounds. Because eating the right fruit the wrong way can cancel out a significant portion of the benefit. I will also give you 5 rules at the end that apply across all 7 fruits. Without these rules, you could eat every fruit on this list consistently and still not give your eyes full access to what they contain. Please stay with me through to the end. Let us start at number 7, and I want you to pay attention to this one because it is almost certainly sitting in your grocery store right now, and you have walked past it many times without thinking of it as an eye health food. Kiwi. As your retina ages, 2 specific processes accelerate. The first is the accumulation of oxidative damage in the photoreceptor cells from decades of light exposure. The second is declining levels of 2 compounds called lutein and zeaxanthin that your retina depends on for protection. Lutein and zeaxanthin are natural pigments that sit inside the layers of your retina and act as internal filters. They absorb harmful, high-energy blue light before it can damage the light-sensitive cells beneath. They also function as antioxidants directly within retinal tissue, neutralizing the free radicals that cause cellular damage during both waking hours and sleep. As these pigment levels decline with age, the retina becomes increasingly vulnerable. The early signs are often what people describe as headlights looking like starbursts at night, vision that takes longer to clear after bright light exposure, or morning dryness and redness that were not there a few years ago. Kiwi contains meaningful amounts of both lutein and zeaxanthin. It also contains a small amount of serotonin, a compound that supports deeper and more restorative sleep. This matters directly for eye health because the repair work the retina does at night is concentrated in the deeper stages of sleep. A fruit that supports better sleep quality is also supporting better overnight eye repair. A study published in the Journal of Nutrition and Healthy Aging found that older adults who consumed 2 golden kiwis daily experienced measurable improvements in visual sharpness, along with reduced morning dryness and eye redness. 2 pieces of fruit, measurable, documented results. Here is how to use it correctly. Choose golden kiwis rather than green ones. Golden kiwis contain more lutein, produce less stomach acid, and are gentler on the digestive system late at night when you are trying to achieve quality sleep. Eat 2 of them approximately 1 hour before bed. There is one preparation detail that almost everyone misses. When you scoop the fruit out with a spoon, do not scrape all the way to the skin edge. The thin layer of flesh immediately beneath the skin contains concentrated caffeic acid, a potent antioxidant. Leave that inner edge intact and you are preserving a meaningful portion of the fruit's protective value. Number 6 is one you probably already love, and I want to address a specific frustration many of my patients describe. That blurry morning vision that lingers for an hour or more after waking up, sometimes longer, and does not fully clear no matter how much you blink or rinse your eyes. Watermelon. As we age, the tiny blood vessels supplying the retina gradually become less efficient. They deliver less oxygen and fewer nutrients per hour than they once did. This reduced retinal circulation is a primary driver of that persistent morning blurriness, because the retina spent the night in a lower oxygen environment than it needed for full repair. Watermelon is over 90% water, so hydration is the obvious benefit. But the research points to something more specific. Watermelon is one of the richest dietary sources of lycopene, a carotenoid antioxidant that has been linked in observational studies to reduced oxidative damage in retinal cells and protective effects against age-related eye conditions, including cataracts and macular degeneration. Research also shows that people who eat watermelon regularly tend to have higher circulating levels of lutein and zeaxanthin in their blood, those same protective retinal pigments we discussed with kiwi. And certain compounds in watermelon support nitric oxide production, the molecule that relaxes and widens blood vessels. Applied to the tiny capillaries supplying the retina, this could translate to meaningfully better oxygen and nutrient delivery during sleep, exactly the window when it matters most. Eat 1 to 2 cups of seedless watermelon approximately 30 minutes before bed. Do not add salt. Added sodium raises intraocular pressure, which is a significant and potentially irreversible risk factor for glaucoma-related vision loss. Here is a preparation detail worth knowing. The white rind section just inside the skin contains citrulline, an amino acid that supports healthy blood vessel function. Most people throw the rind away. You can blend it into a smoothie or eat a small amount of it alongside the flesh. The compounds that support retinal circulation are there, not just in the red flesh. Number 5 is one that most people have genuinely never bought. I include it on this list because the clinical evidence behind it is some of the most specific and solid of any fruit I will discuss today. Black currants. These small, deep purple berries address a specific problem that a stronger glasses prescription cannot fix: retinal microinflammation and reduced blood flow to the optic nerve. Over time, chronic low-grade inflammation inside the eye blurs vision, creates halos around lights at night, and causes progressive strain in dim conditions. These are changes happening at the tissue level, not at the level of the lens, which is why new glasses do not resolve them. What makes black currants particularly effective is their extraordinary concentration of anthocyanins, the deep pigments responsible for their color. Inside the eye, anthocyanins do 3 specific things simultaneously. They calm inflammatory processes in retinal tissue. They support blood vessel dilation, improving circulation to the optic nerve and retina. And they help restore rhodopsin, the visual pigment your eyes use to adjust from bright light to darkness. This last function is directly relevant to anyone who struggles driving at night or moving between brightly and dimly lit rooms. A randomized, placebo-controlled clinical trial involving glaucoma patients found that 50 milligrams of blackcurrant anthocyanins daily over 24 months significantly improved blood flow to the optic nerve head and surrounding retinal areas, and meaningfully slowed the progression of visual field loss compared to placebo. A separate study in patients with normal tension glaucoma found that blackcurrant anthocyanins increased retinal blood flow without affecting eye pressure and helped normalize a compound involved in blood vessel constriction, pointing to genuine neuroprotective effects even in people without a diagnosed eye condition. Fresh black currants are difficult to find in most grocery stores. Look for a standardized blackcurrant anthocyanin extract at approximately 50 milligrams, taken in the evening. For better absorption, pair it with a small amount of healthy fat, such as a few walnuts, or with a vitamin C source, such as a slice of orange. Nutrient combinations genuinely affect how much your body can extract and use from what you consume. Number 4 is one you almost certainly already have at home, but I need to tell you something about how most people eat this fruit that cancels out a significant portion of its eye protective benefit. Blueberries. What blueberries specifically target in the aging eye is oxidative damage to the photoreceptor cells. These are the specialized cells in your retina that allow you to focus, distinguish fine detail, and adapt to changes between light and dark environments. Decades of UV exposure gradually depletes your natural antioxidant defenses in these cells, and the slow damage accumulates. You start squinting at printed text. You struggle in dim light. You find yourself wondering why your vision is blurry even with your glasses on. The key protective compound in blueberries is pterostilbene, a molecule chemically related to resveratrol, but significantly more bioavailable, meaning your body can actually absorb and use more of it. Research suggests pterostilbene can cross the blood-retinal barrier and act directly on DNA damage in light-sensitive cells. This is a meaningful distinction from most antioxidants that are absorbed into the bloodstream but never actually reach the retinal tissue that needs them. A study published in Nutritional Neuroscience found that older adults who consumed wild blueberries daily for 12 weeks showed notable improvements in visual acuity and reported meaningfully less eye strain when viewing digital screens in low-light conditions. Here's the critical detail I mentioned. Not all blueberries deliver the same benefit. The large, shiny, cultivated blueberries in the fresh produce section of most supermarkets have measurably lower antioxidant density. Wild blueberries, the small, darker ones typically found in the frozen section, carry nearly double the concentration of active protective compounds. Frozen wild blueberries are just as effective as fresh ones and are available year-round. Eat approximately 1/3 of a cup of wild blueberries, about 45 minutes before bed. And here's the preparation step most people get wrong. Do not combine blueberries with dairy. The proteins in milk bind to anthocyanins in the gut and physically block their absorption. Your body cannot access the protective compounds that are sitting right there. Instead, lightly freeze your blueberries and then allow them to thaw before eating. This freeze-thaw cycle breaks down the cell walls of the berries and measurably increases the bioavailability of the antioxidants inside, meaning your eyes can actually access and use them during overnight repair. Number 3 surprises almost everyone when they first hear it, both because of what it is and because of what it specifically addresses. Dragon fruit. If you regularly wake up with tired, heavy eyes even after a full night of sleep, eyes that feel like they need another hour of rest, regardless of how long you were in bed, this one is worth paying close attention to. The problem dragon fruit addresses is called retinal hypoxia. This is when your retinal tissue is not receiving adequate oxygen during sleep. The tiny capillaries that supply the retina are among the smallest blood vessels in the entire body. When they become narrowed or less flexible with age, the retina can be significantly undersupplied with oxygen even during a full night of sleep. When that happens, you can rest for 8 hours and still wake up with heavy, fatigued eyes because the repair processes that require oxygen were running at a deficit all night. The variety you choose matters enormously here. You want red-fleshed dragon fruit, not the white-fleshed variety. The distinction is not cosmetic. Red dragon fruit is rich in betalains, a class of antioxidants that research shows can support nitric oxide production in blood vessel walls. Nitric oxide is the signaling molecule that tells blood vessels to relax and widen. Applied to the capillaries supplying the retina, increased nitric oxide means more oxygen and more nutrients reaching retinal tissue during deep sleep. A study published in Frontiers in Aging Biology found that participants who consumed red dragon fruit extract for 6 weeks showed meaningful improvements in ocular circulation, contrast sensitivity, and visual field depth. In practical terms, they could see more clearly in low light and reported noticeable reductions in blurry vision. Eat half a red-fleshed dragon fruit approximately 1 hour before bed. And here is the detail almost everyone misses. Do not swallow the black seeds whole. Chew them. Those seeds contain omega-3 fatty acids and magnesium, both of which play documented roles in retinal nerve health and overnight repair. Swallowed whole, the seeds pass through without releasing most of what they contain. Chewed, they deliver their contents where your body can use them. Number 2 has thousands of years of use behind it for one specific purpose, and clinical research is now providing the biological explanation for why that traditional use was well-founded. Goji berries. The specific problem goji berries target is macular thinning. The macula is the central zone of your retina, the small area responsible for the sharp, detailed vision you use when you read, when you recognize a face, when you distinguish the fine details of anything you look at directly. As we age, oxidative stress and reduced circulation gradually thin and degrade macular tissue. This is the foundational process behind age-related macular degeneration, which remains the leading cause of irreversible central vision loss in older adults worldwide. What makes goji berries exceptional for macular protection is their zeaxanthin content. Goji berries are among the highest natural dietary sources of zeaxanthin on the planet. While lutein provides protection across the broader retina, zeaxanthin concentrates specifically in the macula, your center of vision. That anatomical targeting is precisely why it matters so much for macular health. A clinical study published in a nutrition journal followed adults aged 60 to 80 who consumed dried goji berries 5 days a week for 90 days. The results showed a significant increase in macular pigment optical density, which is a direct, measurable indicator of macular protection. No participant in the study showed further progression of macular degeneration during the trial period. For anyone concerned about preserving their central vision and visual independence, that finding deserves serious attention. Soak 2 tablespoons of dried goji berries in warm water for approximately 10 minutes, then eat them about 30 minutes before bed. Soaking softens them significantly and improves how well your digestive system can break them down and absorb their contents. This matters particularly for older adults whose digestive efficiency has naturally declined with age. Here is a preparation pairing with genuine science behind it. Eat your soaked goji berries alongside a small piece of high-quality dark chocolate, at least 85% cacao. The flavonoids in cocoa have been shown to enhance the absorption of zeaxanthin. The combination produces a synergistic effect that increases how much zeaxanthin your macula actually receives compared to eating goji berries alone. This is not a casual tip. It is a documented nutritional interaction. And finally, the fruit that sits at the top of this list. It is not exotic. It is not expensive. You may have one in your kitchen right now, but when you eat it correctly, it targets one of the most destructive and most overlooked processes driving blurry vision, cloudy lenses, and early cataract formation in older adults. Papaya. The specific process papaya addresses is called glycation. This is something I want to explain carefully because it is one of the most important and least discussed contributors to age-related vision deterioration, and it is happening silently in the eyes of most people over 60. Glycation occurs when excess blood glucose molecules attach to proteins in your eye tissue and bind to them permanently, forming compounds called advanced glycation end products. In the lens of your eye, glycation progressively clouds the normally clear proteins that allow light to pass through cleanly. This is one of the primary biological drivers of cataract formation. In the retina, glycation damages the structural proteins and blood vessels that the photoreceptor cells depend on. The damage accumulates silently over years, long before any symptoms become noticeable. Papaya contains papain, a naturally occurring enzyme with documented anti-inflammatory and protein-modifying properties that research suggests can interfere with glycation processes in tissue. Papaya also delivers a concentrated combination of vitamins A, C, and E alongside folate, nutrients that research consistently connects to tear film stability, retinal protection, and reduced oxidative stress inside the eye. A study published in a clinical gerontology journal found that older adults who consumed papaya in the evening showed lower levels of glycation markers in follow-up testing, alongside stronger tear production and measurable improvements in contrast vision within 6 weeks. For anyone dealing with persistent dry eyes, blurry morning vision, or early-stage cataracts, those are meaningful and specific outcomes. Here is exactly how to use papaya correctly, because preparation matters significantly for this fruit. Eat 1 cup of ripe papaya cubes approximately 1 hour before bed. Take your papaya out of the refrigerator at least 30 to 60 minutes before eating it, and let it come to room temperature. Cold temperatures suppress enzyme activity. Papain loses a significant portion of its functional effectiveness below a certain temperature. You want the enzyme fully active when it reaches your digestive system. Room temperature is the minimum. Slightly warm is ideal. Do not pair papaya with dairy for the same reason as blueberries. Dairy proteins interfere with the absorption of the carotenoids papaya contains. Here is the preparation tip that makes both a nutritional and practical difference. Squeeze fresh lime juice over your papaya before eating it. The vitamin C in lime meaningfully boosts your body's absorption of vitamin A from the papaya. Your eyes receive more of what the fruit contains, and the combination of papaya and lime tastes considerably better than papaya alone. Now I want to give you 5 rules that apply to all 7 of these fruits. These are not general wellness suggestions. They are specific preparation and timing principles that determine how much of the beneficial compounds in these fruits actually reach the tissues in your eyes that need them. The first rule is to avoid high-calcium foods within 90 minutes of eating any of these fruits. If you eat your papaya or blueberries within 90 minutes of having milk, yogurt, or calcium-fortified cereal, you are actively blocking your body's absorption of lutein and zeaxanthin. Research has shown that high-calcium meals consumed alongside antioxidant-rich fruits can reduce absorption of key eye nutrients by up to 30%. Treat your evening fruit as a standalone snack, eaten separately from your last main meal, not as a dessert immediately following dairy-containing foods. The second rule is to always include a small amount of healthy fat when you eat these fruits. Most of the key protective compounds in these 7 fruits, including lutein, zeaxanthin, lycopene, and betalains, are fat-soluble. Your body cannot absorb them without fat present in the digestive system at the same time. A few walnuts eaten alongside your fruit, a teaspoon of flaxseed oil, or a few slices of avocado can boost absorption of the fat-soluble compounds by more than 50%. You are eating the same food and giving your eyes dramatically more access to what it contains, simply by including a small amount of healthy fat. The third rule is to wash these fruits gently. This surprises most people. Aggressive scrubbing under hard-running water removes a significant portion of the surface antioxidants from blueberries and black currants in particular, where the most potent protective compounds are concentrated in and near the outer skin. Rinse gently under cool, not cold, running water. Pat dry rather than rubbing. And wash your fruit immediately before eating, not hours in advance. Washing breaks down some of the surface compounds over time, so the closer to eating you wash them, the more you preserve. The fourth rule is to allow refrigerated fruits to come to room temperature before eating. Refrigeration suppresses enzyme activity in several of these fruits, most critically papaya. Below a certain temperature threshold, papain and similar enzymes lose their functional effectiveness. Take any refrigerated fruit out 30 to 60 minutes before you plan to eat it. Let it reach room temperature fully before consuming it. This single step significantly increases how much beneficial enzyme activity reaches your digestive system and how much of the fat-soluble compounds your body can extract. The fifth rule is about timing, and this one is more precise than most people expect. Eat your chosen fruit 60 to 90 minutes before going to sleep, not earlier and not right before bed. The 60 to 90-minute window is specific for 2 reasons. If you eat too early in the evening, the protective compounds are metabolized, absorbed into general circulation, and largely cleared from the bloodstream before your eyes enter their primary overnight repair window during deep sleep. If you eat too late, your digestive system is still actively processing the food during the initial sleep phases, and active digestion competes with the quality of deep sleep your eyes need to do the repair work. The 60 to 90-minute window allows digestion to reach the stage where the beneficial compounds are available in your bloodstream at the same time your eyes are entering their most active overnight repair phases. Let me bring this together now because I want you to see what all of this actually means for your daily life. Blurry morning vision. Difficulty adjusting to dim conditions when you walk into a darker room. Headlights spreading into uncomfortable starbursts at night. Eyes that feel dry and scratchy before you have even started your day. Squinting at menus and printed text that you could read comfortably a few years ago. These are not simply the inevitable features of an aging body that you must accept. They are symptoms of specific processes happening in eye tissue. Oxidative damage in photoreceptor cells. Declining levels of the protective pigments that filter harmful light. Reduced oxygen delivery to the retina during sleep. Low-grade inflammation in retinal tissue and around the optic nerve. And glycation progressively clouding the proteins in your lens. All 7 of these fruits address one or more of these specific processes through documented biological mechanisms. And all 7 are available, affordable, and practical to incorporate into a regular evening routine. You do not need to eat all 7 every night. Start with the one that addresses the symptom most relevant to you right now. If your primary concern is morning blurriness and dry eyes, kiwi and watermelon are your starting points. If you struggle most in low light or with night driving, black currants and blueberries address those specific mechanisms. If you are concerned about macular health and your central vision, goji berries are the most directly targeted option. If you experience persistent dry eyes, blurry vision on waking, or have been told you have early cataract changes, papaya should be your priority. And if you wake up with heavy, fatigued eyes despite adequate sleep, red dragon fruit addresses the oxygen delivery problem specifically. Begin with one fruit. Prepare it correctly. Eat it in the right timing window. Do it consistently for 4 to 6 weeks. Your eyes do not change in a day, but they do respond to what you consistently give them. And the research supports that meaningful changes in the right direction are achievable within weeks to months for most older adults who implement these habits correctly. One final thought before I close. If someone in your life is struggling with the kind of vision changes we have discussed today, an older parent who has stopped driving at night because of the headlight glare, a friend who mentioned their morning vision has not been right for months, a partner who has been to 3 different optometrists without getting a satisfying answer, please share this with them directly. The information that supports your eye health is only valuable if it reaches you at the point where there is still time to act on it. Your photoreceptor cells have a repair capacity. The window to support that capacity is right now, not after symptoms have progressed to a point where they are much harder to address. I'm Dr. WillIiam Madison. Take care of your eyes. They are the way you see every person and every moment that matters to you. Take care of yourself, take care of the people around you, and I will see you in the next video.